All right. When it's time to seek out a sports medicine orthopedic surgeon, the specialists at General Physician PC can help you now and help you when you need it. You weekend warriors out there, you can also even be helped from becoming injured again. Our Courtney Corbetta is there with details.
Hey everybody, we are here this morning with Dr. Lisa Daye of the General Physician PC Orthopedic Sports Medicine practice. And this morning we are going to give you an inside look at the practice because we want all of our viewers to know you don't need to be an NBA player or an NHL player to come here.
Yeah, certainly not. Yeah, the great thing about my practice is we get to take care of people who are of every age. So I take care of little kids, middle-aged people, even, older people. I mean, lots of people are a lot more active than they used to be. So everybody's out there being active, doing all these healthy things. So it's fun. So I get to see a broad spectrum of people. And actually, it's more fun to take care of the kids that are out there just doing it for fun and not getting paid the big bucks to do it.
Exactly. And that leads us to our first question this morning. Who needs to see a sports medicine orthopedic surgeon? Who should come to you?
So for my field, basically, like I said, it's all ages, but it's usually after some sort of injury. So in this weather, it could be a slip and fall on the ice, or it could be you slipped and fell and crashed into the boards playing hockey, or you injured it playing rugby or ski racing. So it's any kind of injury. So it could be slip and fall, could be sports injury, could be a work injury. So anything that, creates that kind of problem, they can come in and certainly we can check it out and figure out what's going on.
And we're talking about the day-to-day athletes or the weekend warriors, those who are just going out there to have some fun, whether they're kicking around the ball or playing some ice hockey.
Exactly, right. So we're talking about the kids in like Little League, football. We're talking about your high school athletes, your college athletes. Actually, a few years ago when the West New York Flash was in town, we took care of the soccer team, so that was kind of fun.
Oh, that's neat.
When I did my fellowship, I did take care of Buff State's hockey team, so that was fun. So it's kind of fun to take care of that range of athlete, but we definitely also take care of the weekend warrior, those that forget that they're not still 20 years old anymore. They're fun to take care of, so it gets to be a lot of fun because you're taking care of all sorts of people.
Well, once Western New Yorkers make their way to you, let's talk about the procedures and the treatments that they may come to you for.
Okay, so when they're here, usually they've had some sort of injury, but not everybody needs to get rushed off to the operating room. So usually what we try and do is we try and figure out, what's going on, and we try and make it feel better and function better. And so usually we're starting with something simple like some medicines, maybe an injection, going to physical therapy. If that doesn't work, then they may need further imaging. And then we decide, okay, if nothing else is working, now we're really talking about surgery or not.
And as much as we like to see you, Dr. Daye, I know a lot of us don't exactly want to go to the doctors. It's not our first place that we would like to be at. So what are some things that we can take from day to day to prevent injuries, especially if you're an athlete or one of those weekend warriors?
Right, we actually try and counsel all of our athletes after they've been injured as to how to stay out of the office. We definitely have frequent flyers, but we're trying to actually keep them out of the office, not in the office. So one of the best things they can do for themselves is to make sure they keep themselves in shape. There's great training programs out there. There's lots of core work that can be done. So the better shape they're in, the less likely they are to get injured, the less likely they are to come back again.
Let's talk about where we are today.
Today physically, we are way out in Lakeview, which is kind of fun because there's lots of snow and ice out here, and so we see patients out here. We also see them in our Amherst office, and so that allows us to see a spectrum of people across Western New York also.
For Western New Yorkers who are hesitant to come here, what would you say to them to kind of calm their nerves?
Well, nobody really wants to come in to see the doctor. Everybody always says, yeah, I kind of waited on this one. And quite frankly, for some things, unless there's really a significant injury, waiting a little while using a little ice or Motrin is not a bad thing. But if you really can't go back to doing what you're doing, rather than putting your head in the sand, it's very painless to come in and figure it out. And we'll give you options that don't necessarily mean a needle or surgery. So we're happy to kind of figure that out and make it as painless as possible.
Thank you so much, Dr. Daye. It was so nice to meet you. So everybody at home, if you would like more information on sports medicine, it's really simple. All you have to do is visit GPPC online today.